Let's begin with an in-depth discussion with a couple of opinion leaders from around the world. The global spread of the coronavirus was finally declared a pandemic this week by the WHO, as over 120 countries grapple with the cases. As the language shifts from epidemic to pandemic, how should the world's response change accordingly? To delve deeper, we have joining us today Dr. Stanley Perlman, who has been studying coronaviruses like COVID-19 for the last 38 years. We also have joining us Dr. Benjamin Cowling from Hong Kong University, an expert on transmission patterns of respiratory diseases. Well, the global death toll from the coronavirus has surpassed 4,900, with more than 134,000 confirmed cases. Italy now has the highest number of deaths outside mainland China, but compare it to countries like South Korea, which has a higher number of infections, but a much lower percentage of deaths. So, Dr. Perlman, my first question goes to you. Why are some countries reporting much higher fatality rates?
Well, I think that the easiest answer is that the countries that have lower fatality rates are actually doing a better job at detecting minor illnesses, patients who have minor upper airway sickness. So they come in, they get tested, and they're considered positive. If countries are not doing as well in controlling the infection, they may test people who are only more severely ill, and in that case, the mortality rate will increase because those are the patients, of course, who succumb to the infection.
I see. So countries with lower fatality rates are doing more, perhaps, to handle the outbreak. Well, I'd like to hear from both of you on this question. The WHO has said that it will deal with the way it will deal with the outbreak and the response from countries around the world as well won't be changing drastically, and that the virus can still be controlled. But we see some differences in how countries are actually handling the outbreak. European countries, for one, they're focusing on increasing testing as well as hospital facilities. In contrast to that, Japan has reportedly tested fewer people relatively, and the US as well. And both countries have announced travel bans on people and an increasing number of travel bans on people coming into their borders. So which approach do you think is right? Let's start with Dr. Cowling.
I think travel restrictions at this stage won't do a lot of good. In the countries that are considering them, in Europe or the US, there's likely to be many more infections domestically than would be brought in through travel. But there's a different case for maybe South Korea, Hong Kong, Singapore, where we currently have very few local cases, but are importing an increasing number of infections from those affected places, Italy, maybe in the future United States or other European countries. And so travel restrictions might make more sense here, because then we can reduce the pressure of imported cases, then transmitting locally and requiring control measures.
So you're saying that one size doesn't really fit all. Well, what about you, Dr. Perlman? How should countries be responding to this pandemic now?
Yeah, so I agree with everything Dr. Cowling said. I think that a country like the US has been really hampered by having very inadequate testing. So as a result, we don't really know how many people are infected, and it's much harder to initially control that by quarantining or isolating those people. Now we have gone into a mitigation stage where we're doing these large-scale changes to prevent spread further. But I think that a situation like ours, where most of the cases are domestic and are community-acquired, the notion of curtailing flights from Europe or even from China at this point, I don't think are going to help at all. Or not much, I shouldn't say at all.
Well, what really is the difference between mitigation and containment? Dr. Perlman.
Well, I think Dr. Cowling is probably better. I can give an answer, but I think Dr. Cowling is actually expert in this. So I'll throw this back to him.
Right. Well, what do you say, Dr. Cowling?
Yeah, so it's two different objectives. The objective of containment is to stop an epidemic from occurring by identifying every single infected person as much as possible and then stopping them from spreading it onwards. And one of the ways to do that is to quarantine the contacts of infected people so that if they have been infected, you catch them before they have a chance to spread it. The objective of mitigation is somewhat different. In mitigation, We understand that an epidemic is going to occur. For example, in the United States, in many European countries, is unstoppable now. So the purpose of mitigation is to slow down transmission so that hospitals don't get overwhelmed with too many patients at the same time. That's one of the biggest problems in pandemics. And we've seen what happened in northern Italy with hospitals being overwhelmed.
Well, Dr. Cowling, the country where you are right now in East Asia, countries like South Korea and China have seen the number of additional daily cases getting lower and lower. Why do you think this is? And do you think that the downward trend will continue?
Yeah, it means containment's working, but we need to be alert for outbreaks, like in Seoul in the call center. There could be other outbreaks that haven't yet been detected. Containment measures work as long as we have the resources to identify cases and then to isolate them and to quarantine their contacts. If we stop being able to do that, for example, if there are too many cases, if there was another large outbreak in Korea or for that matter in Hong Kong or Singapore, we'd have a lot of trouble tracing the contacts, quarantining them, and then it would be very difficult at that point to continue containment. So for now, it seems okay. The numbers are low, but we need to be very careful, especially for large outbreaks.
And Dr. Perlman, China and South Korea, they've been seeing their numbers drop, but what about countries like Italy and also the US, where we're seeing what seems like a sudden spike in the number of infection cases and deaths as well? Do you think the current approach is right? Or how do you think the public health system should really adapt to support the growing number of patients?
Yeah, I think that what we saw in Italy was that the infection was not being contained and that large numbers of patients were becoming ill at the same time, which was overwhelming the healthcare system, as Dr. Cowling pointed out. In the U.S., I think that the lack of testing we have is just a huge problem. In Washington, where we have our biggest outbreak, I think there were lots of people who were infected way before we identified them. Even now, the state of Iowa has 15 cases and one person in an ICU and a very, very limited number of testing kits. So we are definitely behind the 8 ball in testing. I think it's widely recognized. It occurred for several reasons, and it's not going to catch up immediately. It's probably going to take us a week or two, and then we may have an even bigger spike because the best way not to detect cases, not to find cases, is not look for them. So once we start looking for them, we're going to find them.
And Dr. Perlman, the focus so far has been on containing the number of infections, keeping them very low, but what could be the long-term health impact for those who are severely affected?
Yeah, so the people who are severely infected, I don't think we know the answer to that yet. Based on SARS work and other work with severe respiratory viral infections, I think it's very likely that at least some of them are going to have long-term consequences, certainly in their lungs. This virus seems to infect several organs. There's a hint that there's more brain infection than there was with the SARS coronavirus. And if those patients survive, then they may have long-term neurological or psychiatric effects. I think this is all up in the air now because we don't have enough long-term survivors who had severe disease to really know. But I think that people in China have the best group of people to study for this, and I think they're actively looking and answering this question.
So we'll have to wait and see for some long-term health impacts. Well, before we go, again, I'd like to hear from both of you. So some experts say that millions upon millions of people across the world could be infected by the COVID-19 before it starts waning. And some say it will come back wave after wave as a seasonal virus. So let's start with you, Dr. Cowling. What's your view?
Yeah, I think it's unavoidable now that a lot of people are going to be infected with the coronavirus in the next 6 months. What we have to avoid is that a lot of people are affected at the same time, because if too many people are infected at the same time, we're going to see hospitals becoming overwhelmed. But I think it's unavoidable that a lot of people are going to be infected in the next 6 to 12 months. Infections are almost always mild, particularly in younger adults and children. The vulnerable groups that we're particularly concerned about protecting are the elderly and those with underlying medical conditions. And then, as you mentioned, probably in a year or two's time, it'll be back again as a seasonal virus, perhaps with less impact at that point because it would have infected more people in the first year. And so the second year is just picking up more people that haven't been infected.
And how about you, Dr. Perlman? What's your view on this?
Yeah, my view is similar. I think that this year, a lot of people will be infected, but maybe not enough to prevent the virus from coming back in subsequent years. And I don't know if this will ever be quite like the seasonal flu, because the mortality rate is just too high in aged people and people with underlying conditions. So we have to see what's going to happen with that. But my best guess also is that it'll recede this year and then come back, possibly even next fall or next spring. These are all predictions that we really don't know the answer to, but the hints from this is a respiratory virus, it's not going to go away, and it's very contagious. So I think we're going to see more of it.
And just before we go, well, Dr. Perlman, based on your studies on SARS and MERS in the past, how can we really boost our immune system really to this new coronavirus?
Yeah, so this is a tough question because our studies show that patients who had MERS and SARS, their antibody titers tended to, which is part of the protection against reinfection, tended to wane pretty quickly. We don't really know if they're protected still because the number of MERS cases is 2,500, the number of SARS cases is about 8,000. The likelihood of somebody being reinfected is just really small, so we don't have good information about how well they're protected. Unfortunately, from this infection, we're going to be able to learn that information because we're going to have people who will be exposed enough so that if they can be infected twice, they will be infected twice. And of course, this also for vaccine development.
Well, while scientists and experts like yourself work on this kind of vaccine and find out more about this new virus, Dr. Cowling, what can the members of the public do in the meantime, in addition to maybe social distancing and washing hands? What else could we do?
I think the most important thing now is to protect our vulnerable elderly and people with underlying conditions in the community. So if we have elderly relatives, find ways that they can stay at home more, and let's look after them, because if they're infected, it's much worse than if we're infected.
I agree, we do have to protect our vulnerable, especially the elderly, like you said, Dr. Cowling. Well, that's all we have time for today. Thank you so much, Dr. Stanley Perlman and Dr. Ben Cowling from the University of Iowa and the University of Hong Kong.
You're welcome.
And that brings us to the end of this programme. Thank you for watching. Have a lovely weekend wherever you are. Goodbye.